Good Friday afternoon, everybody. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer of the Knox County Health Department. Charity Menifee will be joining me shortly to talk about the data and benchmarks for this week. But first, I'd like to dedicate today's moment of gratitude to the businesses and individuals who gave their feedback in either of two reopening surveys. We also want to thank Visit Knoxville for housing the community survey on their website and collecting the results. Through these two surveys, we were able to get valuable input about phase 1 while also receiving feedback for phase 2 and 3. I'd like to spend a few minutes talking about what we saw in the surveys. Some of the feedback was encouraging as it related to behavior. For example, on the community survey, the majority of respondents said they were practicing physical distancing guidelines, wearing a mask, and avoiding large gatherings. However, 25% of the respondents still said they were not wearing a mask or avoiding gatherings of more than 10 people. As it relates to reopening, a majority of respondents on the community survey want to see our community moving towards less restrictions on what is open, but they want to continue with guidelines around wearing a mask in public, sanitation, and physical distancing. On the business survey sent out through our listserv, some organizations wrote in specific reopening challenges. Some of these challenges include patrons not listening to or respecting employees, concerns about employee safety, getting the appropriate supplies to follow the guidance like masks, thermometers, and other things, and confusion about how a business was to be classified. We also asked respondents on the business survey what ideas they had for phase 2 guidance. Some of those include increasing capacity of patrons inside businesses, allowing more businesses to be open within specific sectors as long as they were able to maintain distancing guidelines, more public education, ideas for how to make specific businesses be in compliance, such as pools, food truck parks, and gyms. Those are just a few, but all of the responses were greatly appreciated as we made guidance to shift into phase 2 next week. Now I'd like to talk a bit about phase 2 reopening guidance or recommendations that we released to the public and put on our website earlier today. First, we'd like to pull up our website to show you where the guidance can be found on covid.knoxcountytn.gov. There's a section in the navigation bar that says reopening plan. When you click on this link, you'll see 4 blue boxes. The first is the reopening plan that details the phase 1 guidance. The second is the phase 2 amendment, which has all the guidance that applies to phase 2. By clicking that link, you will have access to the document in PDF form. We aren't able to go through it in its entirety in this format, but we encourage all of you to read it and review it and in its entirety, and we'll take questions from the media in just a few minutes. We know the public will have additional questions. That's why we are grateful to 311, who is taking the lead on answering reopening questions from businesses and the public. We've also created a team who can answer industry-specific questions. Those questions we refer to this team by 311. So make sure you call 311 first. Once again, we want to express our gratitude to 311 and to the amazing team answering questions for the public. Your hard work is very much appreciated. We also want to stress, just because phase 2 is set to begin Tuesday and your business may be permitted to open, that doesn't mean you have to open your business. It just means you can if you'd like. Nobody knows your business better than you do. So we are counting on businesses to make the decision on whether to reopen based on the health and safety of their patrons and employees. And it wouldn't be a proper media briefing if I didn't talk about the 5 core actions everybody needs to continue practicing in phase 2. Those include, say them with me, physical distancing, wearing cloth face coverings, frequent and proper hand washing, cleaning surfaces, and staying home if you're sick or have been asked to stay in isolation or quarantine. And one final note, we know summer is upon us, and I believe the state is coming up with some guidance for youth sports and recreational sports. So we'll be looking for that to come out and reviewing it and sharing it when it becomes available. Now I'll invite Charity up here to talk about the case count and this week's benchmarks.
Good afternoon. Moving into our local situation, we have 327 confirmed cases of COVID-19 in Knox County. Additionally, we have 6 probable cases. 295 of our cases have recovered. 38 individuals have been hospitalized at some point in their illness. And we have 2 Knox County residents that are currently hospitalized. We are also thankful that we have no additional deaths due to complications from COVID-19. Now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistical significant shifts within a 14-day time period. Every day we look back at the previous 14 days. That's what a rolling average is. Overall, what we mean by this is we are trying to see if things are staying the same or if they are getting worse, and if so, how much worse. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. As of today, we meet that qualification. Thus, we have a green traffic light for this benchmark. As we mentioned we would do last week, we have added trend lines to a few of our graphs to help the public better understand the trend in which our data is going. We also added a new graph that shows new cases per day with a trend line. That makes the new cases easier to see. We are thankful to our epidemiology team and our IT department for assembling and presenting this data in a meaningful way. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs. One that shows the tests conducted for Knox County residents and another for average time between specimen collection and lab report data. What we want to see is testing staying the same or going up and reporting time staying the same or decreasing. Based on the qualifications we mentioned for a shift in traffic light colors, this benchmark meets the qualifications for green. Our third benchmark, sustained or increased public health capability. This chart shows the number of individuals currently on the epidemiology support team. At 31 people, this is still an adequate number to handle the current contact investigation volume. Based on our current caseload, this benchmark meets the qualifications for green. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. This data is gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County residents, East Region residents, or patients from other jurisdictions in all of our regional hospitals. From this benchmark, the traffic light remains green. In full transparency, we did experience a statistically significant increase in the utilization of ICU beds. A 3-day trend was detected. However, because the number is so low to begin with, even a small increase registers as statistically significant. This is similar to what we talked about last week. Also, you might notice on the third table that the percentage of available hospital beds and ICU beds has decreased this week. But this is normal and expected to happen as hospitals begin resuming elective surgeries and other services. As you can see by the first 2 graphs, these beds are not currently being filled with COVID-19 patients. Consequently, the decision to keep this traffic light green came after talking with hospital partners and getting their input, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we show the chart that details cases, hospitalizations, and deaths. This benchmark remains green because we have not had an increase. And now we'll open it up for questions.
Please go ahead and submit your questions into the chat feature now. Get back on our spotlight video here. Okay. Our first question is from WATE. They say hospitalizations went from 39 to 38. Was this a person living outside Knox County?
Yes, I would have to double check with our epidemiology staff, but generally when the numbers go down, it was somebody that had been, when we investigated, was not actually a Knox County resident. But we'll double check that data.
Yeah, we can get back to you with that information. Also from WATE, could you further define a recovered case? The website says it's a person out of isolation. How does the health department know a person is ready to be released and recovered?
So we follow the state and CDC guidelines for what it means to be recovered or and which is released from isolation. And what that is, the guidance actually changed relatively recently. So it is now they have to have been 10 days from onset of symptoms, or if they don't have any symptoms from the date that they were tested, plus 72 hours or with 72 hours fever-free and starting to feel better. And so that can be it's at least 10 days, and it can be longer depending on how long it takes symptoms to subside.
All right, and Charity and Dr. Buchanan will be switching off here answering questions, so give us some time so they can pivot from one side to the other. The next question is from the Knoxville Liberty Press. They ask, the task force committee meeting have been held creating and enacting public policy without being open to the public in violation of TCA 844-101-201. When will all the meeting minutes, motions, and other information be released to the public for review? And also, when can we expect accountability for violating Tennessee sunshine laws?
So first of all, this committee is an advisory committee. There actually were no motions, no voting took place, simply advising on how to create recommendations for our community on reopening. So we are working with our law department to make any documentation available. We actually did not, they didn't even have minutes because it really was conversation, discussion, advisory process. We again are working with our law department to rectify that and move forward in an open manner and sunshine those meetings going forward. It's a learning curve for me as most of the sunshine meetings I attend, somebody else does all the work to make sure it's done properly. So we're learning how to do that, and we'll do it properly.
From WVLT, should individuals who are not part of vulnerable communities feel comfortable patronizing businesses that will be allowed to open under phase 2?
I think you need to take a look at the business, and if the business is abiding by the guidelines and doing so properly, we believe, and if you're abiding by the guidelines, we believe that you can safely patronize that business, keeping yourself safe and protecting the employees as well.
Another question from WVLT, should everyone continue to avoid public spaces, or is it safe to go out to eat, patronize bars, and other activities as long as social distancing is maintained?
So again, I'll remind everybody that kind of similar to what I said before, if a business is not following social distancing and you don't see employees in masks and they should be, and if you and other people are not following social distancing and wearing masks as recommended, then it's not safe. But if everybody's following social distancing and wearing a mask and washing their hands, and really important, stay home if you're sick, it's safe to be out. But the CDC has kind of switched some of the guidance and really recommends, and I think some of this might be based on larger cities where it's impossible to have 6 feet of social distancing when they start reopening, but really recommending wearing a cloth face covering anytime you're outside your home in a public setting. And I know that's what I'm doing now.
WBIR is asking if there will be a media briefing on Monday. We will not be having a traditional media briefing, but we will be sending out after this media briefing today an opportunity for you all to still get your questions answered on Monday. So be looking for that in your email inbox from the Joint Information Center directly after this media briefing. Sorry to interject there. From WATE, they say a viewer asks about neighborhood and community pools. They're asking if they are under the same guidelines as a commercial or public pool.
Actually, neighborhood and community pools do fall under the same guidelines. So any water venue, a pool, splash pad, any of those things will need to follow the guidance as written in the plan.
Another question from WATE. What advice could you share for a business that encounters a patron unwilling to follow guidance? And likewise, what should a patron do if they see a business disregarding the rules?
So the last question is easier to answer. If somebody observes a business not following the rules, or they're concerned about whether they're following the rules, you can call our 215-5555 to share that, or 311. And 311 is the other place you can lodge that complaint. And then those are followed up by our staff, or sometimes by city staff, depending on the location and what type of business it is. When a business owner has a patron who's not following the recommendations, it's up to the business owner how they handle that. And they need to make that decision on how they handle that internally. And that's really kind of a business management decision.
From WBIR, how many state-issued masks has the health department distributed?
We've done over 11,000.
I'll let Charity answer that.
Okay. I believe the information we had received this morning is we here have given out over 11,000 and over 100,000 to community partners to get out, with a portion of those going to Knox County schools that are seeing people and others. So we've done a good job with those, and appreciate the state providing those for our county residents.
From WBIR, phase 2 is coming a little faster than planned. Do you think people will follow the guidelines? And if not, will we go back to phase 1?
We really hope they do. We think it's even more important now, the more people are out and about, that we do follow those guidelines, and we'll be watching it closely. And if the data changes, we'll get together and make recommendations again here and to our elected officials about moving forward and what that looks like. But we're really hopeful that people will continue to do the right thing, and that our data will continue reflecting that.
From the Sentinel, sorry, it scrolled down on me there. From the Sentinel, one of the survey questions was roughly, how do you think the response has gone? One of the top replies was, as I expected. Can you describe how the task force considered this answer? Was it considered a positive or negative? A lot would depend on their expectations going in, right?
Sure. And I guess what I have to say is that I honestly don't recall discussing that specific question with the task force. So I apologize, but I can't answer that question.
From the Knoxville Liberty Press, who are these advisories decision made in the task force committee given to enact as a public policy?
The advisory committee is advising me as the health officer under Executive Order 30. Governor Lee gave Metro health departments the authority to create plans and do things slightly different than the state as a metropolitan independent health department. That was given under Executive Order 30.
From Sentinel, theaters will be allowed to open next week, but what are the limits for an individual theater? Less than 50 people, more than 50, but separated seating?
It's a detail I do not have in my head. And so we can get back to you on that, or you can read the guidance.
For some of those specific questions, if you want to submit them to our Joint Information Center, we can work to get some of those more specific questions about the plan answered. Any other questions, please go ahead and submit them now. From WBIR, can places like pools and Meads Quarry limit how many people can come?
Again, it actually with water features and pools really is based on what happens on the pool deck or outside the water. The water is really not the concern. It's the social gathering nature of going to the swimming pool and it being summer. So they have to space tables 6 feet, at least 6 feet apart, and be able to rearrange furniture on their pool deck and follow those guidelines for social distancing, just like everybody else.
From the Knoxville Liberty Press, with the new CDC recommendations coming out in regards to school operations, how will this impact the school season this fall?
One, I haven't seen those yet. And two, that's a decision that'll be made by the schools.
Any other questions? Please go ahead and submit them into the chat feature now. From WATE, some people still feel a sense of guilt for scheduling a massage, eating inside, or even getting a haircut. Would you speak to the safety of phase 1 and phase 2 activities if guidelines are followed?
Sure. So, especially in phase 2, we really, when we looked at this, we took the approach of how can we help businesses open safely? And so knowing how COVID-19 is transmitted, we spray it out when we talk, sing, cough, sneeze, laugh. So we know that wearing a face covering protects other people. So if both people are wearing a face covering, even if you're close together, your risk is very low. It is not primarily through touching things, and actually that's relatively new guidance from the CDC. We're really seeing that it really is more about those droplets that are coming out and that close proximity to other people, and those droplets being able to get into your mouth or nose or eyes. So we believe the guidance really helps provide some safety and security, but it's totally dependent on everybody doing what's in the guidance.
Any other questions? Please go ahead and submit them now into the chat feature. And we are waiting for some questions to be submitted to us from an individual who is having some IT technical issues. So we're going to try to get their questions. They're texting them to us right now, so we'll try to get those answered. So sorry if everyone can just hold tight real quick while we get those in.
All right, there should be music playing.
Yeah.
I can sing.
Jeopardy.
In the meantime, as a reminder, just mentioned a second ago, but if there are specific questions related to the plan, I know a couple were asked here, if you would send those to the Joint Information Center, and we'll work today on getting some of those specific questions answered for you. From WATE, how concerned are you, Dr. Buchanan, about a Memorial Day spike?
So certainly holidays are challenging. We had Mother's Day, now we have Memorial Day. So I'm not concerned as long as people follow the guidance and observe those 5 core principles of social distancing, wearing a cloth face covering, staying home if you're sick, cleaning things regularly, and I've forgotten one of them. Wash your hands. How can I forget that? Wash your hands regularly. So if people follow those guidelines, and I'll be honest, the other thing that would be really, we're advising folks who are higher risk, and those are older folks and people with chronic illness, to avoid crowds. And even though it sounds like a really great idea to bring grandma and grandpa out for the picnic, you might want to just think about not doing that. It's just, I know it's not fun, but it really protects their health. So be thoughtful in your celebrations and follow the guidelines.
All right, any further questions submitted into the chat feature now? All right, we have not received any questions via text or email, but we'll make sure to get back to those for the individuals who are having some technical issues today. Since I'm not seeing any further questions in the chat feature, we'll go ahead and log off. Thank you all for joining us. We appreciate it, and be looking in your inbox in just probably about 30 or so minutes for an opportunity and ways to get your questions answered for Monday. Thank you, and have